Thank you so much. Thank you so much, Erica. And I want to start by thanking also Elida, Jessica, and Benu, the childcare providers who spoke earlier, as well as those tuning in. I echo Justin that you are all the foundation of our community. So thank you so much for being here. My name is Erin Hogeboom, and I am Director of Policy and Strategy for San Diego for Every Child. I'm going to go ahead and share my screen here briefly. Okay, and at San Diego for Every Child, we sincerely believe and are dedicated to the belief that together we can end the experience of child poverty. San Diego for Every Child is a countywide coalition of individuals and organizations committed to cutting the experience of child poverty across our region. Today, I'll be talking you through a bit about us, as well as introducing you to the Children First Collective of San Diego, and finally providing a snapshot of our region's efforts to focus on childcare facilities and more specifically, co-locating childcare facilities in affordable housing for both family homes and centers. I'd like to begin with this stark statistic for you. In San Diego County, pre-pandemic, the American Community Survey showed that 40%, nearly half of all of our children under 12, are living in households making less than double percent of the federal poverty level. We doubled that level because has not been changed really since 1963 besides inflation. And we know that for a family of four making $53,000 a year in San Diego County, you are still struggling to make ends meet. Our approach at San Diego for Every Child is threefold to tackle this big entrenched societal problem. First, we know it's going to take all of us pulling in the right direction to get there. This means having everyone having an awareness and the data at their fingertips to empower their advocacy. This awareness building and advocacy comes from a culture shift across our county, one in which we see all San Diego children as our children and support policies and system changes that really work for families. Second, all that we do is in collaboration and focuses on coalition building across the four service sectors of childcare, housing, hunger relief, and healthcare. We know that it is so important to ensure that basic service sectors are working together at a systems level to take the onus off of families. It's why we help bring this framework to every conversation and make connections necessary for action. Our co-location work is squarely couched in this pillar of our work in the Children First Collective, which I'll talk about in a second. And finally, we operate with the deep belief that families are the experts of their own experience, and that as those that they are closest to both the problem and any potential solutions, those solutions are best driven and guided from that perspective. In this third pillar of our work, it currently takes the form of an incubation of San Diego's first guaranteed income pilot project, which I'm always happy to talk about or refer folks to my colleagues. So our work has one through line, and that is to be responsive to community need and what we're hearing from families. It's no surprise that families want to live nearby access to healthy food, reliable healthcare, and quality, affordable childcare. And for affordable quality childcare, we know the basic equation is two things: workforce and facilities. Now, I'm going to tell you a little bit about the Children First Collective and how we got started looking at facilities. San Diego for Every Child helped co-lead the Children First Collective, which is an initiative bringing together passionate voices across the San Diego childcare ecosystem, including system leaders, providers, employers, and parents. Together, we are creating a local movement across San Diego County with an urgent mission to make quality, affordable childcare available to every working family that wants and needs it, as well as to ensure that providers and childcare workers are compensated, supported, and respected as the professional educators that they are. The work of CFC predates the pandemic, but COVID-19 really catalyzed this group, and the advocacy efforts that CFC has helped lead has brought over $60 million in the childcare sector locally in a region where there had previously been no local investment. CFC's areas of focus are listed here, but of course the most important for discussion here today is increasing childcare facilities, which includes both family childcare homes, centers, and any other types in a mixed delivery system. Boom. CFC really began to tackle the issue of facilities in the summer of 2021, where an ad hoc work really brought to light the to the collective partners where the sticking points were in regard to facilities expansion and what was needed. These discussions and insights from childcare providers brought about a number of developments. It helped inform, for example, the mission-driven finance program, CARE, a national real estate investment trust that is an integrated real estate investment strategy. It's built both on expanding childcare facilities and homes while also helping the bottom line for childcare centers and wealth building for family childcare providers. And in fact, we have Laura Cohn on the, I saw her tune in today, and the CARE Access Real Estate Investment Trust also brought San Diego County $1 million in a federal appropriation, San Diego's only federal appropriation last cycle, and an excellent example of a public and private partnership. It also carved a path for us to start a line of advocacy with the City of San Diego to perform facilities assessment of the city-owned locations that could be utilized for childcare, which has now spun into the need for a city council-driven effort to update local statutes to allow for childcare on these properties. It has also spurred conversation with the city around greater protections for childcare providers from abusive landlords. And finally, it reinforced the seed that had already been planted, which was that it's absolutely necessary to fully understand the importance and barriers of co-locating childcare within new and renovated affordable housing developments. When it comes to building affordable housing, particularly housing that is meant to serve families with working families, where so much emphasis is placed on supporting pathways to stable employment, childcare must be top of mind. It does no good to build affordable housing only to look back and wish we would have had the insight to build it in such a way that allowed for an essential business and reliable tenant like childcare, something that could really serve the needs of working families both in the building and in the broader community. We know the affordable housing system is complex. We know that the childcare system is complex, which is what, all the more reason we need this co-location pilot to understand how these two sectors can best work together, because it can mean real, tangible improvements in the lives of children experiencing poverty. So I'll end on this. I once met with a parent who commuted 40 minutes each way from her affordable housing to reach affordable childcare in addition to her work commute. Think of what a difference an extra hour and a half a day would mean to her and her child. When we think about a family already stretched to make ends meet, this would make all the difference in the world. Thank you so much for your time and attention today.